Well, the challenge of improving maternal health in Arkansas is daunting, and it goes well beyond a single solution. Our state, of course, has one of the highest maternal mortality rates in the country. And that ugly reality is now demanding attention from Arkansas's political leaders. Tonight, Channel 7's Kaylin Clay begins a three-part series on the search for solutions that can save lives.
Shocking statistics affecting real Arkansans.
My fear at that time was, what if my baby comes and I'm on the way and I have the baby in the car? I thought it's kind of inconvenient to live so far.
Arkansas is one of the worst states to have a baby, earning an F grade. According to March of Dimes, the state ranks 6th in the nation for having the most maternity care deserts. Those are counties that have limited or no access to maternity health care services.
That is 38 of the 75 counties in Arkansas.
Just over 50%, up from 45% last year. This is the extent of Arkansas's maternal health crisis.
Hi, bud.
A woman's first tear as a mother often comes with the first cry of her baby, the moment she's imagined for 9 months. But what happens when she can't access the clinical care she needs? And that moment takes an unexpected turn. Maternal health care is a cause that Arkansas Surgeon General Dr. Kay Chandler cares deeply about. A Little Rock-based OBGYN, her efforts to improve care extend across the entire state.
That's one of the things I really am passionate about, is talking about women get to your prenatal care visits. But even before that, we need to be at the healthiest we can be before we ever get pregnant.
The heartbreaking truth: obstetric units are disappearing. Dr. Chandler points to recent closures in Newport, Ashley County, and Bradley County, highlighting how rural areas are being left with fewer options for care. Expecting mothers are now forced to travel further for essential health care, putting not just their own lives at risk, but the well-being of their babies as well. Both vulnerable, in need of life-saving support.
We're a pretty rural state, and so you've got a big hub of, hospitals and care and all in central Arkansas and then northwest Arkansas. But being a rural state, that makes it a little more difficult. It's harder to recruit to those areas.
It's not an easy crisis to sift through. There are many pieces to this puzzle.
One of our biggest concerns is, probably the biggest, is chronic health.
Chandler says chronic health conditions have risen, making the journey to motherhood risky for some, especially those living far from adequate care.
We have a maternal mortality review committee that looks at all the maternal deaths in the state. And over the last several years, the top 3 or 4 were cardiovascular disease, diabetes, hypertension. All those complications are the things that are the biggest cause of the morbidity and mortality.
Each year, about 1,000 women don't seek prenatal care at all, and about 10,000 don't begin care until late in their pregnancy. Amid a complex and fragmented issue, a call to action emerged. In March of 2024, Governor Sarah Sanders signed an executive order aimed at supporting moms, protecting babies, and improving maternal health. This led to the creation of the Arkansas Strategic Committee for Maternal Health.
Before March 6th, when the governor gave the executive order to support moms, protect babies, and improve maternal health, there were a lot of people doing things, and there still are a lot of people doing things, but it was like, well, over here we're doing this, and over here we're doing that, and over here we're doing this, and there was just a realization or understanding that we need to get together and develop a unified roadmap for maternal health.
After roughly 20 development meetings, the plan was delivered to the governor on September 5th. It included key recommendations such as improving coordination and data reporting.
We have to have a dashboard to see how are we doing. We got to know where we are, and we have to know where are we going with this, how are we doing. And then also, what are the resources? If a woman maybe wants to do the best she can, but she doesn't have access to all the resources, there are a lot of resources. So that's where the community outreach and education comes in too, and establishing a large website, a database that's going to allow women to be able to go to that and say, oh, here's where I can go to get this, here's where I can go to get that.
Through this website, expecting mothers will have easy access to resources like food pantries, transportation services, and breastfeeding support, all just a click away. But it's more than just a directory. It's designed to promote health literacy. A key element in addressing these challenges is expanding the workforce through community outreach. Chandler emphasizes that having an adequate number of family doctors in the state could pave the way for a family doctor obstetrics residency program, which would improve access to care in underserved areas. She also points to Medicaid access as a critical concern that requires attention.
We know that's an issue. We know we need to look at the reimbursements for all providers at all sites to see if we can increase access and be able to, draw more people in or be able to provide the services that are needed.
These are the issues driving the committee's work, all directed towards shaping future legislative action. With various efforts in motion, Dr. Chandler envisions a brighter future for babies, mothers, and their communities.
I think with the movement that's going, with all the people that are working on this, I'm really positive and really excited about the future for not only just maternal health, but for infant health. And then, of course, when you have healthy moms, healthy babies, that contributes to healthy communities.
That's our Kaylin Clay reporting. Tomorrow night, she'll talk to Arkansas lawmakers to find out how they're planning to address the issue in next month's legislative session.